Hi, my name is Dr. Kendra Brandstein. I'm the director of our community programs here at the center.
My name is Shirley Pacheco, and I'm a volunteer here at Scrips Hospital and at the Wellbeing Center.
Hola, mi nombre es Lucy Varías y fue diagnosticada con cáncer en el 2013. Me sometí a una mastectomía, primero la lampectomía y luego a 32 sesiones de radiación. Estaba yo desesperada y como loca, pero seguí con el medicamento tamoxifen. Luego en el 2014 me vuelven a diagnosticar cáncer con la terrible noticia que mi única opción era una mastectomía total.
I was diagnosed initially with invasive ductal carcinoma in my right breast, and 9 months later, after I finished my treatment, I was diagnosed with invasive lobular carcinoma in my other breast. So I underwent a double mastectomy with immediate reconstruction. And today, I'm done with my treatments. I do take tamoxifen, which I will have to take for another maybe 7 years. It's 10 years total. And basically, I'm doing well. I go in for my checkups every 6 months and have had no problems.
We offer a variety of health and well-being services, support groups and classes through Scrips Mercy Hospital, Chula, Vista. This is the arm of our hospital's community benefit world and community services. That a support group is, fostering this positive mentor-like environment for women, and that those who are feeling alone, have a new diagnosis, or confused with the treatment process, to reach out to support groups. And I think this support group is open to help and guide any woman or family member, or male for that matter, in this community who needs that support. And it makes a difference. The women, I've seen tremendous growth in each and every one of them from the day they started here to now, a year later, and how they feel better about themselves.
Well, when I found out about the cancer, I have to be honest that I really wasn't shocked. Breast cancer runs in my family. My sister's a 13-year survivor. And so I've always been on top of my health when it comes to my breasts. I've always had problems with my breasts. So I started mammograms when I was in my mid-20s. And so I've always been very careful not to get, lazy with health concerns. So I was always on top of things, and I really wasn't shocked. It was almost like I was expecting it.
Pues todos estaban sufriendo. Yo creo que estaban sufriendo más ellos que yo, porque pues yo estaba un poco más valiente. Ellos estaban totalmente quebrados porque todos pensamos cáncer es igual muerte. Pero no, estamos dando la batalla.
My family the same way. We've gone through so many breast cancer illness that it was like, oh, one more person now. But it was very supportive, obviously, but not shocked like most people. It's difficult. For me, when I got that second diagnosis, it was like, you've got to be kidding me. I just finished 9 months ago my treatment, and I have cancer in the other breast. But my first reaction was, get these things off me. Get them off me. I don't want them. I'm one that I have to work very, very quickly. When it came to my health, I didn't want to drag my feet. I went home immediately. I started doing research. What's the best thing for me? It's my body. I have to be happy with what happens to my body. So, the second one was kind of a hard one to take because I wasn't expecting it. But I faced it the same way I faced it the first time around. And that's what I tell people. You got through it the first time, you fight the second time just as hard.
Because the isolation and being alone is difficult when you're going through crisis. So they support each other. Also, navigating the health system, Scrips is less complicated than other systems, of course, but no matter what, it's so complicated figuring out what to go to, how to do it. Treatment is complicated oftentimes. And so these women are able to come together and share their own personal experiences with each other.
Well, I know that people think they're going to die when they have cancer, But I chose to look at reality. You know, we've come so far with treatment, with breast cancer treatment. I felt very confident in my team. I was a patient at Scrips, La Jolla, at Torrey Pines, and I had a lot of confidence in my team, and I had confidence in the treatments that have come so far nowadays for breast cancer. So I never really thought about death. It never entered my mind, and it still doesn't enter my mind.
Pues claro que sí me asusta la muerte, pero creo que voy a vivir un poco más. No quiero morir, estoy en tratamiento y creo que eso es lo bueno, ponerse en tratamiento, porque el cáncer tiene cura si hay una detección a tiempo.
Cancer, I think people let cancer limit them. I didn't. I was retired at the time that I was diagnosed, and I chose to live my life and continue. Even when I was going through treatment, I was walking 6 miles a day. I didn't let that get me down. I pushed myself. I wanted to stay positive. It was very important to me. So positivity and laughter were very big for me. And that is what got me through, is that and knowing that I was just going to survive. I was going to do well.
No, just that support groups, I think in general, I think this models not only our community, but the commitment of giving back to one another to help and support each other, and then Scrips's support to actually do these type of programs.
The support groups is a twofold for me. I'm the facilitator of the breast cancer group, and I love to see the ladies come in and be open to being educated, being open to one another, and being very supportive of one another. I get a lot of satisfaction seeing that. It's important for me to educate them, to empower them. It's important, especially in our culture. The Hispanic people tend to think, I'm gonna die, things are gonna be bad for me, I'm not gonna be able to live my life like I used to, and I want them to see that you can live your life like you used to. You know, once you go through the treatment and everything, life continues, and you have to move on. You have to enjoy it, because if not, you're gonna miss out on things in life. Life will pass you by while you're worrying about dying.
Pues más tranquila, ya sé lo que han hecho para mí los doctores, estoy haciendo todo lo que me han recomendado. Traté de cambiar pues mi forma de vivir, más tranquila, cuidándome más, haciendo más ejercicio.
One of the things that I always tell women when I speak to them in their first diagnosis is, number one, I always let them know that we've come so far with treatment, with breast cancer, especially in breast cancer. We've come so far with treatment. They also have to educate themselves. They can't rely on what one person tells them or what a doctor tells them. They need to ask questions. They need to educate themselves. They need to stay positive. First and foremost, I tell women that your body follows what your mind is telling you. So if you're thinking, I'm gonna die, this is not gonna work for me, your body's gonna follow that. So you have to try to stay positive, and you have to have faith in something. You know, there are a lot of people that have, religious faith, and there are a lot of people that have faith in other things. Just grab onto something, hold on to it, and know that you're gonna get through. You have to be strong. A lot of people think that, your family gets you through, and it's great to have your family, your friends being supportive of you, but the first person that gets you through this is you. You have to get yourself through this. No one else is gonna give you that strength. I love quotes, and there's a saying that says you can't start the next chapter of your life until you close out the last one. And that's what you have to do. You can't live in that cancer mode all your life. You have to move on with life.
And the data really does show that if you have somebody who's been there and can model and sort of guide the process, you are better off in the end. And the model that we use here at the center is using promotoras, which are local community people who have been there, experienced it, speak the language, and can relate to the people.
To know that there are a lot of women around that are cancer, in remission. I'm not gonna say they're cancer-free, you're in remission. There are a lot of women who have been through cancer and have been, past the cancer for 5 years, 15 years. We have one lady in our group who is 17 years free. I mean, that's, to me, it's very beneficial for other people to know. I mean, you can move on and life and life continues, and you're not going to die. Unfortunately, there are some situations where that might be the case, but it's not in every case. And even in the most severe, there's still treatments that are being done nowadays.
Claro que sí, un grupo de apoyo como este me ha abierto aquí con información, que es lo más importante.
I think the most difficult feeling or emotion to surpass is uncertainty, because that's what it is. It's a 50-50 game. You've had, your breast removed, you've had treatment, you've had whatever it is that you went through. You feel, okay, now I'm free of cancer. But the reality is that cancer can come back in another part of your body and attack, vital organs in your body. So you always have that in the back of your mind. So that uncertainty is always there, and some people have a lot of difficulty getting past that, where most people, I think after a while, they start to see, my life is starting to feel normal again, and so maybe I can just continue on and move forward.
Pues no sé, el cáncer no se nota realmente, no te pueden discriminar, porque a menos que tú digas, tengo cáncer.
Sí,
pero
sí,
no, nunca he sufrido discriminación de ninguna clase, ni con los doctores, ni nada.
And yes, there are some women that come into the group and they will feel, and they'll tell us afterwards, they will feel depressed or they feel sad. And then at the end of the group, they come up to us and they say, I'm so glad I was here. I feel rejuvenated. I feel excellent. I'll give you an example. I had one of the ladies that you actually interviewed today, when she first came to our group, the next day she was going in for a mastectomy. And she was very quiet, very tense. And she finally said at the end, I'm having surgery tomorrow and I'm scared. I don't know what I'm gonna look like. And so I showed her my breasts. That's what I do. That's what the women love. They love when I go, woo, and I showed them my breasts and I said, I had them both removed and I'm fine. I have new boobs, I'm happy. Hey, I got those things off me, and that was important to me. I didn't want them on my body anymore. And she came back the next time and she said, because you showed me your breast, I walked out of here and I felt so much more confident about what I was gonna go through the next day. I really felt like I'm gonna be okay.
Estaba yo desesperada, no sabía qué hacer, estaba enojada. Cuando sonó el teléfono y era Raquel Sandoval del grupo de apoyo, que me invitaba a venir, y bueno, aquí estoy. He encontrado mucha más información de la que mi médico me dio de lo que era una mastectomía. Ellas me enseñaron, inclusive una de las integrantes, Shirley, me mostró cómo quedó y su reconstrucción, entonces ya salí más tranquila. Es lo que he encontrado en este grupo de apoyo, información. Ellos han conseguido para nosotros, para las muchachas, que así se llama el grupo ahora, oncólogos, terapistas del linfodema, ha traído nutricionistas, ha traído entrenadoras, para hacer que todas nos sintamos mejor porque eso es lo que hace falta, información. Y cuando uno no tiene información no sabe qué hacer, está uno desesperada y la familia no te puede comprender qué está pasando porque pues no les ha pasado a ellos, por eso estoy aquí.
So yeah, there are women that come in and they're sad, they're in different, planes of their life. And in our evaluations, because we do give them all evaluations, a lot of them say, I come here because when I leave, I'm happy. I come here and I forget things. It's 2 hours of laughter and talking and sharing and real support, because I love the fact that when we have a new member, when that member comes in, we always have them introduce themselves, talk about, what their journey has been like. And the women, it's amazing how supported they are with that one person. Immediately they just pour it out, and even if someone has problems driving over here, you'll always have the ones that say, I'll pick you up, don't worry about it. They're so helpful with one another. And they socialize with one another outside the group. So, they've really established a really good bond, very, very cohesive group that we have. And I'm so proud of them, because a lot of them from day one to now, totally different. They want to help the other women that are in the position that they were in when they first started coming to our group.
Lo primero es informarse y venir a un grupo de apoyo porque ahí puedes obtener información, te demuestran qué va a pasar, qué les pasó a las demás personas. No te sientes solas, te comprenden más porque ya lo han vivido. Y como este grupo de apoyo, te digo, nos traen personas que nos dan la información. Entonces yo incito a las personas que están diagnosticadas con cáncer, que están en tratamiento de cáncer o que son sobrevivientes, que vengan porque se aprende mucho. En este grupo, por ejemplo, compartimos recetas, compartimos información, buen humor y pues salimos con un mejor espíritu.
It's a community service, and it's Scrips' way in our hospital at Chula Vista of giving back to the community, and it's a community need.
With regards to the group, I feel that the community needs to know that we do have a place where you can come to. We're not family insofar as blood is concerned, but a lot of the women here in our group say this is family for them. And that's really important because you'll have the women that'll say, I didn't want to come into this, I felt horrible, but I pushed myself and I came in. And I needed that support. I needed to know that it's gonna be okay, and I get that from this group.
So the support group's only been here for a year. So we're on our year anniversary. And it started off, very few women, and it's obviously grown significantly. And 19 people is a large number for a support group. We keep our fingers crossed that if we have to grow, that we find a larger location, but that we really, 19 is a good number for our space. We may grow and need to explore options for that.
I like to speak to that, on camera, because that's one of the things. We give out evaluations to our ladies after every meeting. We have them for the presenters, and then we have it for when we have just, open forum day. And so twice a month we meet. The first Monday of the month is just an open forum where everyone is just, chatting with one another. They give each other ideas, oh, I've been feeling this, and then they kind of share, little recipes that they've come up with to deal with little things that are cancer related, health-wise, nutrition. And then the second meeting that we have in the month is an educational part. Where we bring in health care professionals to talk to the ladies about, topics that are cancer related and that affect them now. That we have women that are starting treatment, we have women that are in the middle of treatment, and we have women that have completed treatment.
No, al contrario a ustedes, porque nos van a tratar de informar a las demás personas que cáncer con soledad es malo. Necesitamos estar con un grupo de apoyos para llevar mejor esta batalla, y con cariño y apoyo es mejor que estar uno solito. ¿Verdad?
We meet twice a month. We meet the first Monday of the month. We meet the third Monday of the month. The first Monday of the month is an open forum, like I mentioned before, where everyone just kind of shares information. And women bring food. It's like a fest. It's like a big party. And then the third Monday of the month, we have a health professional come in and talk about a specific topic. And then we get the women also involved in other things. And I forgot to mention, last year we participated in the Komen Race for the Cure. We participated in the American Cancer Society, making strides. We were invited by the Chargers on their Breast Cancer Awareness Day. We were out in the field, and we came out on television. We were invited to the Aztecs basketball game, their Pink Day. And again, they were singled out as a group of breast cancer survivors. So these are things that they probably would never have been exposed to before. So I like that they're willing to do that. They love it. And we try the best that we can to get them involved into anything that's out there that's breast cancer related.
About half of our patients actually that come to our hospital are Spanish speaking, more than half. In this particular area of Chula Vista, about 75% are Spanish speaking. So our community is predominantly a Spanish speaking community. The requirement is that you've either had cancer, been diagnosed with cancer, in remission, or going through that, or know somebody for that matter that's going through it. Our location is 237 Church Avenue. The telephone number to call here is 619-862-6600. And you can speak to anybody here. stop by also. We're in the neighborhood.